The specific modification that you do to mosquitoes, to the genome, to have a specific characteristic really that you want. Like, for example, you can affect the fertility of mosquitoes in a way that, the reproductive capacity in the field is really very diminished. Or you can also do the modification in the way that is going to inhibit the development of the plasmodium in mosquitoes, so they are not able to transmit that anymore. So that is the general, I will say, modification. Then now you tie that, to a specific system that we call the gene drive, whereby when you take these mosquitoes and then you release them in the field, your gene of interest, which is conferring this specific characteristic to mosquitoes, either affecting their fertility or inhibiting the development of plasmodium, mosquitoes are just going, to take this gene of interest and then spread it across the entire population of mosquitoes. And so let's say, for example, that you are affecting the fertility of mosquitoes. So if you release this kind of mosquitoes and then they spreading the gene, so it means that it's going to affect the reproductive capacity. And then along the line, you will realize that, the density of mosquitoes in the field is just diminishing to the point where you have only really very few mosquitoes, and then it's going, just to stop the malaria transmission. So the process of spreading, the gene really very quickly is what we call the gene drive. That mosquitoes that we released in Burkina Faso in 2019 were not gene drive mosquitoes. Because, the technology, the way we are developing it, we have different phases. We have phase number one, whereby we have, non-gene drive sterile male mosquitoes, genetically modified, that when you release these mosquitoes in the field, so they won't be able, to get any progeny because they are sterile. They mate with the wild female, there is no progeny. But this was done intentionally. First, because they are genetically modified, we want, to release them, have, some scientific data that are going, to inform the next step. But at the same time, also, we wanted, to build capacity on the ground and also test the regulatory system just to make sure that the regulatory system is ready and prepare, for the dossier of the gene drive in the future. So the release has been done in 2019, and then we are at the second phase now. And then once the second phase is done, the second phase still is going to be about non-gene drive mosquitoes. And then the gene drive mosquitoes will come at the third stage. We're doing that intentionally because it's a new technology. So there are a lot of concern around. So we have to go step by step in a very precautionary way, increasing only gradually the exposure of the environment, to the gene of interest really that we want. When we get to the gene drive per se, and we do the release, it's going to be sustainable. And this is a big difference with the conventional tools that we have. If, for example, you take bednet, obviously these are not genetically modified mosquitoes. But if you take the case of bednet, for example, you need to go to every single village, to distribute that. So if you don't have a good road, it's become really very difficult. People also have to comply because I can get the bednet, but if I'm not using them, it's useless, right? And so with the gene drive, you don't have, to worry about that really, because when you release it in a public space somewhere, it's going to cover everybody, rich or poor people in the same village or in the same area. Everybody is going to be protected by it. That's the first thing. The second thing, as I said, you don't have, to go to every single village. You just, inseminate few villages. And because the gene of interest is taken by the mosquitoes themselves and spreading, to the rest of the population, then even in the remote villages where you don't have a road, to go, even if you have instability there, mosquitoes, they don't care. They fly everywhere around. So they will take your gene of interest and then spread it. Then the logistic, for you to deploy it is going to be really quite easy. And even the cost also is going to be easy because once the gene has started, to spread, that's it. You don't have to release anything anymore. This is why we think that this is really the way to go. It's going to be sustainable, cost effective, and also in the long term, we think that it's going to have a lot of benefit. Target malaria is operating in a few countries in Africa. That is Burkina Faso, you have Uganda, then you have Ghana, and you have Mali as well. But obviously, our intention is to expand and go beyond this country. And right now, the technology are more or less there. I will say gene drive mosquitoes exist already. They are in the lab, not necessarily in Africa, with our partner, for example, in the UK. The gene-drive mosquitoes exist. But in no way we will allow ourselves, to take these mosquitoes, go to the field, and then release them right now. Because there are so many other things around that you need, to solve first. This is the stakeholder engagement activity just to make sure that you have the public acceptance. And that really takes time. And you have the regulatory issue as well, because, when it's come to gene drive, you release mosquitoes, let's say in Burkina Faso, they don't respect any human borders. They will just fly around. They will go, to all the neighboring countries. So how do you really make sure that the regulatory system across, the region is ready? So this is exactly what the AUD NEPAD, which is the technical branch of the African Union, is working, to harmonize the regulatory system across, the West African region with what they call the ECOWAS. When they succeed there, then they will duplicate the same thing in Central Africa and then in East Africa, so that it's become continental. So that once one country has the mosquitoes released, and then everybody is going, to be ready to accept it. So it's going to take a little bit of time. To give you a really specific timeline, I think it's kind of a little bit difficult, because working only with mosquitoes in the field, in the lab or in the field, that's quite easy. You control your time. But stakeholder engagement activity, this is something that you don't control. So the outer NEPAD is working on that. So whenever they are ready, with the regulatory system to allow us, to go to the field and release, then we'll do that. So I will say, we can say maybe something like 4 or 5 years down the line. This is something which is really fundamental and critical in the development pathway for us. And this is even one of the reasons why we're not just taking the mosquitoes right now and then going to the field, because we have to be really very careful and look at all these specific potential risks that we might have. And how do we really make sure that we have a very clear identification of this risk? And then also, if anything, how do we mitigate them? So coming, to the ecosystem, in fact, we very often have 3 or 4 questions concerning that. Like, for example, you're targeting a specific species. The question is that what is the role of this species in the food web? Are predators, feeding on these mosquitoes? If you remove them, what's going to happen to the predator? Is it just going, to collapse the ecosystem or not? So, and the second question also is that, are there, competition between these mosquitoes and other mosquitoes in the larval breeding site? If you remove, then you're creating a vacuum. What's going to happen? Are other species coming, to occupy this vacuum and going, to bring more problem than what we have now? And then the third issue also very often that we hear is that, mosquitoes, even intraspecific, like within a single species, if you go to any breeding site, so if you have larvae of the same species, obviously they're competing for the resources in the breeding site. So if you reduce the number, so it means also that you reduce the competition, for access to the resources, nutrient there. So it means that mosquitoes that might come from this breeding site, given that they don't have much competition for the food, then they might be maybe big, better quality of mosquitoes. And how is that going to impact the vector competencies, like, the ability to transmit the disease? So all these are really questions that we are looking at. And then we have designed a really very elaborate, I would say, study, for example, already in Ghana, where we have been looking, on the role of these mosquitoes in the food web, and also even the role in the pollination. But so far, we've done a lot of study there, but there is absolutely no evidence that show that these mosquitoes either are involved in the pollination or are obligatory prey for any, other predator. And we're also doing, this other study where we, constraining the larval food in the breeding site for mosquitoes, so that we have, bigger mosquitoes, larger mosquitoes, and then we challenge them with the plasmodium. These are not genetically modified mosquito, of course, but we're just challenging it with wild mosquito just to see what is going to be the impact. And so far, the preliminary data that we have here show that there is no impact, even if the mosquitoes are bigger. But these are things that we are continuing, to work on. And once we'll have all the data, I believe that by the 4 or 5 year frame time from now, we'll have all the data, and then we'll be ready to go to the field as well and do the release. Not a single tool will be able to eliminate malaria in Africa. Let's be honest. So we're really very happy about, all these new vaccine. And by the way, the vaccine has been really tested in Burkina Faso by some of my colleagues. So we're really proud, and then they're going to roll out, the vaccine now in Burkina Faso and many other parts of the country, the continent. So that's really very good. And we're absolutely convinced that the vaccine will have a really very big impact in reducing the death toll and then also the malaria cases in many places. But it might be really very difficult to think that the vaccine will be able to eliminate completely malaria in Africa for several reasons. Is that, the logistic of deploying, that across, a country, and then the compliance also, all people also make it sometimes very, very difficult. So it's really very good that we have the vaccine. We have to celebrate it because this is the first time. We're really very happy, but still we need to expand our toolbox so that we can include other things that can take care of, some residual pocket of malaria transmission where the vaccine maybe not, the potential to reach all these people. I mean, gene driver technology is something which has a lot of potential. Can work in malaria mosquitoes, can work on other mosquitoes, or can work on other even vector-borne diseases. So right now we really focus on malaria because this is the first primary health issue, most in across the entire continent. So we really focus on that. But if it's works, so it means also that it can be transferable, to other mosquito disease, mosquito vector like, the dengue mosquito Aedes. But that being said, we must admit also that there are some technology that are already out there with the dengue mosquito, like the Wolbachia. People are using Wolbachia, to alter the dengue transmission. And this is something that people have been rolling out now in many places across the world. Like if you go to East Asia, you go to South America, we have not it yet in Africa, but we're starting also to work on that. So these are some other possibilities that we have, but it doesn't exclude that one day we may want also, to use gene drive on these mosquitoes if it's work with the malaria mosquitoes. Yeah, well, I think the motivation is coming from different front. First of all, basically, I was born and then raised here in Burkina Faso. This is West Africa. So all my entire life, basically, I've been experiencing malaria. Several episodes. I can't even tell you how many episodes. And then also all my relatives that I know, everybody has been, through malaria episode. And I'm, father today and experiencing also malaria through my kids. It's makes things really very difficult. So anything really that can come and then help, I think is good really to take. And so, I've been interacting with mosquitoes really for quite a long time ago, before even the event of Gene Drive. So the early days of BedNet, we were all excited because I even did my master's degree and then my PhD on the use of BedNet. We were really very excited, but as we know, BedNet have been really instrumental, in decreasing the death toll of malaria. But today we got to a point where we see that these conventional tools have reached the protective limit. So we're stagnating. So it's mean that if we don't bring new tools, in no way we'll be able, to cross the last mile of malaria elimination. And so once we get in contact, with our collaborator at Imperial College, this was in 2012, and we were starting, to see the insecticide resistance emerging, pretty much everywhere in Burkina Faso and in many places in Africa against, the insecticide that we are using on bednet or even in IRS as well. Then we realize, well, even though bednet are doing a really fantastic job, they will not be able, to eliminate malaria because we're seeing resistance everywhere. So this new tool, when you see really the potential that they can have, the big impact really that they can have, we say, well, this is really the way for us to go. Especially when you look at the statistic of malaria in Burkina Faso, in many places, the statistic of malaria were like on the downside, like they were reducing, the morbidity and then the mortality. But for some reason, unfortunately, in Burkina, even though the mortality was kind of decreased a little bit, but the morbidity, like the cases of malaria was, just going up. And we couldn't really understand why. And so when we saw that there is this new technology that can help with, we talk to the government and then we say, okay, this is the way really for us, to go. If it can help, to expand the toolbox and be able, to reduce really the burden of malaria, that will be good. So this is why we got engaged, how we got engaged.